Today let's study kidney stones. There are four types of kidney stones: calcium, struvate, uric acid, and the cystine stones. If kidney stones are not treated, leads to hydronephrosis and pyelonephritis and acute kidney injury. Hydronephrosis means excess fluid in the kidney due to backup of the urine. That is, urine cannot be sent out, so it will back up to the kidney. And pyelonephritis, it is the inflammation of the kidney due to bacterial infection, and kidney stones also leads to acute kidney injury. Symptoms of the kidney stones include unilateral flank pain, colicky pain that radiate to the groin, and hematuria. Unilateral flank pain is between the ribs and the hip. Colicky pain is a sharp and sudden pain, like a spasm and a wave. Patients show pain in this region, and colicky pain radiates to the groin. Since kidneys are backside of our body, pain will be in this region. And all kidney stones are radio opaque, except radiolucent kidney stones include uric stones, uric acid stones, and the cystine stones. The first kidney stone include calcium stones. We have two types of calcium stones: calcium oxalate and calcium phosphate. Most calcium stones are of calcium oxalate, about 80%, and calcium phosphate stones include about 20%. These are radio opaque on both CT and X-ray, and these are like envelope shape and dumbbell shape. And the most common cause is idiopathic hypercalciuria. In these people, there will be normal serum level of calcium, but there will be calcium stones. And other causes include ingestion of ethylene glycol, which is an antifreeze. It can be ingested intentionally or without knowing. And vitamin C overuse can also cause calcium stones. And in Crohn's disease patient, there will be fat malabsorption. Fat binds to calcium and oxalate will be left free. Hence, this causes calcium oxalate stones. And the treatment for calcium oxalate stones include thiazide, as this increases the reabsorption of calcium in the distal convoluted tubule, and citrate. As we know, citrate is needed for calcium reabsorption. And low sodium diet. Let's see how low sodium diet is the treatment for kidney stones. When we take high sodium diet, this increases the extracellular volume and this decreases the RAS system. Hence, there will be decreased sodium reabsorption from the proximal convoluted tubule, and hence there will be decreased reabsorption of the calcium. And the next kidney stone is ammonium magnesium phosphate stone. These are also called struvate stone. And present with increased pH, that is, pH will be increased, that is alkaline pH. These stones are also radio opaque and on both CT and X-ray, and these are like coffin lid shape, sarcophagus, as we can see here. These are like coffin lid shape, sarcophagus, and the calcium uric oxalate stones are like envelope shape. The causes for struvate stones include bugs, urease positive bugs like Proteus mirabilis, Staphylococcus saprophyticus, Klebsiella. These hydrolyze the urea to ammonia. When urea is converted to ammonia, this makes the alkaline environment, that is decreases the pH. Hence, there will be increased formation of struvate stones. This is commonly formed as Staghorn calculi. As we can see here, this whole radio opacity is a stone. This cannot be treated struvate stones caused by the ammonium magnesium phosphate should be surgically removed, and the underlying cause, that is eradicate the bugs causing this condition. Uric acid stones make up about 5%, and the risk factor include decreased urine volume, like arid climates, that is hot climates, and in acidic pH, and strong association with hyperuricemia, example in gout condition, in example Leishman syndrome, and myeloproliferative disorder condition, example leukemia, where cell turnover is more and the nuclear turnover will also be more. As we know, when nucleotides are broken down, they will be converted to uric acid. Hence, this causes uric acid stones. And the treatment include alkalinization of the urine and sometimes using allopurinol. The next type of stones are cystine stones. These are also formed in low pH conditions, and on X-ray we find them as radio opaque, faintly radio opaque, and on CT they are moderately radio opaque, and they are hexagonal shape. As we can see here, they have 6 edges. And the causes for cystine stone include autosomal recessive condition, where cystine reabsorbing transporters in PCT will be abnormal. Hence, there will be increase cystine in the urea and decrease cystine reabsorption. And in this condition, there will also be decreased reabsorption of the ornithine, lysine, and arginine. But since these three molecules solubility is more, these will dissolve in the urine, but cystine will not dissolve in the urine and hence causes cystine stones. And it usually begins in the childhood, and it also has Staghorn calculi. Staghorn calculi in childhood is due to cystine stones. Staghorn calculi in adult is due to ammonium magnesium phosphate stones. And the treatment for cystine stones include low sodium diet, alkalinization of the urine, and chelating agents like theophylline, penicillamine,